47 years after the discovery in Nigeria, one virus that has continued to rear its ugly head in the country is Lassa fever. Today on Sound Health, our focus is on measures for prevention and control of the disease. I'm Olasumbo Modupe. Welcome to the program.
Lassa fever, also known as Lassa hemorrhagic fever, is a type of viral fever. The virus was first discovered in 1969 from a case in the town of Lassa in Borno State, Nigeria. The disease is spread through contact with the urine or feces of an infected multi-mammate rat. Many infected by the virus do not develop symptoms, and when symptoms occur, they typically include fever, weakness, headaches, vomiting, and muscle pains. The risk of death once infected is about 1% and frequently occurs within 2 weeks of the onset of symptoms. Among those who survive, about a quarter have deafness, which improves over time in about half. Recently, the Nasarawa State government and no fewer than 8 people have so far died following outbreak of Lassa fever in the state. The Director of Public Health in the state's Ministry of Health, Dr. Ibrahim Adamu, disclosed that of the 11 confirmed cases recorded since the index case in November 2016, 8 have died, while 3 others are responding to treatment.
Recently, 8 people reportedly died in Nasarawa State following outbreak of Lassa fever. Today on the program, Dr. Adibayo will give measures on prevention and control. Welcome to Sound Health, Doctor.
Thank you very much. It's a great privilege to be on the program today.
Doctor, last year about 1,300 patients were placed under surveillance. Just last week, about 8 people reportedly died in Nasarawa State. What is Lassa fever and what are the causes?
The animal reservoir that is implicated here is actually the multi-mammate rat, which actually called the Mastomys natalensis. Now, it just is a different rat that has breasts, like 6 breasts in the chest too. But it's actually very difficult to pick this rat because it's not possible for every one of us to be picking rats in the ground and actually be. So all of us have to be very, very alert, and we have to actually maintain some good level of hygiene.
It was discovered about 47 years ago in Borno State. Why do we still have the prevalence?
Fine. In 1969, in the town called Lassa in Borno State, this disease was actually first was discovered then. But the major issue about this is this. If it is possible, because I actually said it's a zoonotic infection, the implicated organism is a rat. If it is possible for us to actually destroy or kill all the rats, fine, we'll be able to achieve, a sort of eradication. But that is not possible. And that is actually one of the reasons why we are having outbreaks now. Then people will have actually reduced their laxity in maintaining a good, proper hygiene. Now people are not so conscious of that, and because of that, we're having outbreaks of this disease now.
Aside from fever and weakness, what are the other signs and symptoms of Lassa fever? Okay,
fine. It's a multi-systemic disease. Once you are affected with Lassa fever, it affects all the organs, all the systems in your body. And the incubation. Let me quickly talk about the incubation period first. The incubation period is actually the period of infection when you get the disease and when you start manifesting symptoms. And it's actually between 2 days to 21 days. Within these days, people can actually start manifesting the disease. Now, some of those things that you can see, you have said it is fever. And we can also talk about generalized body weakness. You just notice that nothing is wrong with you, you start having weakness. Then also, you can have headache. You can be having severe backache. You can actually be having sore throat. In some people, they do have pharyngitis. Then in some, now, as the symptoms progresses, the severity now comes into play. At that point, the main viral hemorrhagic disease will now manifest itself And that is how we start having bleeding from the gum, we're having bleeding from any orifices of the body. Then also we can actually have bleeding from the gastrointestinal tract. So these are other core symptoms that you can see. Then in some people too, they have a transient maculopapular rash in their body. They notice a rash in them. So when you notice all these things, it's better before you start having bleeding. You know, I said bleeding is actually the later one you actually see, bleeding from the gum and the rest. Before you have that, when you notice you have severe backache, fever, malaise, as you have said earlier, it's better you present to the hospital so that you actually pick this thing on time and start treatment.
Doctor, what is the prognosis level and the chances of survival? Is the chances of survival high?
Well, that is actually a very tricky question, kind of. You know, Lassa fever is actually, well, at least confined to the sub-Saharan Africa. I know what that means. That means we're talking about Nigeria, Liberia, Sierra Leone, and some other West African countries. Now, people don't really take their health seriously. If I ask every people when was the last time they actually visited the doctor now, can actually be like, oh, no, I don't go to hospitals. It's only when I'm so sick. That makes it very difficult. Prognosis of Lassa fever actually depends on the time of presentation. If the patient presents early, then the prognosis will be very good. We have high prognosis. But in a case whereby the patient actually presents when you have all the full-blown disease, now have bleeding from the gum, have bleeding from every other part of the body, gastrointestinal bleeding, the patient is prone to what is called hypovolemic shock. And most of them die from this hypovolemic shock. Late presentation worsens the prognosis. But early presentations, there are some investigations that should be done. We can use the PCR, pulmonary chain reaction. We can actually use an ELISA technique to actually detect this virus. Once this virus is actually detected at an early stage, we can actually use ribavirin. Ribavirin are proved to be effective if it is done at early onset. So now, in the case of prognosis, it has two ways. It's either if you present very early, the prognosis is good, but if you present late, definitely we'll be talking about 15 to 20% fatality rate. And that is why in the statistic you earlier gave, 8 people died after being isolated for the Lassa fever.
What is the incubation period like?
Well, prevention, some people say is better than cure. Yes, it's better prevented than to think about the cure. Well, let me actually take you back memory lane. I'm sure during the crisis of Ebola, you notice even on the streets of Lagos, if you want to even enter a bus, anyone of you have to queue, you give yourself some space. Now, we actually maintain high level of hygiene. People don't just do anyhow. People wash their hands regularly. People avoid contacts with individuals. That also is actually one of the ways that we can maintain to prevent Lassa fever. So as an individual, we should make it an utmost thing that fine, our environment, our community must be clean. Because if our communities are clean, no reason for any rat to be there. Then we should actually try as much as possible to prevent rats from entering into our house. Now that is because we will not be exposing ourselves or our food to rats. Now another thing we need to do is all our grains, foods, we should always put them in a rodent-proof containers. In a container that all these rodents can actually not have any contact with. That is one thing. Then if you have a patient, if you have a family member too, that actually has Lassa fever, that is suspected to have Lassa fever, then we should just be very careful. We should maintain high level of hygiene to actually prevent contact with such individuals. So my own advice is, now we should treat everybody as a Lassa patient. And when you treat everybody as a Lassa patient, you have high suspicion of index, then you maintain high level of hygiene.
How can the disease be prevented? Is there a cure?
Well, you know, the rats infects, or whatever the rat touches with the urine, the feces, and the saliva gets infected. Once the rat is actually infected with Lassa virus, the moment it actually gets infected with in contact with any of these grains, then when you take it in, there is problem there. Now, that is one. You know, humans can get infected when you inject all those infected grains. And you know, there's this popular thing now, because of the low socioeconomic problem we have in this part of the country, part of the world. Most people, okay, if you have a noodles now, that you notice part of it is being eaten, oh, I can't throw this away. Do you understand? Then you decide to still eat that kind of a thing. You have a bread, you have a leftover bread, and somebody actually took part of the bread. You notice that you just pull it away and throw it away. It's a virus. It makes it a major problem for us. So definitely what we need to do is, if humans can actually get in contact with that contaminated food, they have the Lassa virus. That is one. Then two, anybody that is having that virus too, person to person, once you have a contact with the fluid, body fluid of that individual, be it saliva, be it urine, be it blood of that individual that is actually infected, you definitely at higher risk of having the disease.
Our markets are dirty. The way we store our food, the food storage system is so poor. What can we do to curb this, to work on this?
Well, one of the things we can do is, one, we need to give people a good awareness about this disease. Thank you for this chance for me to actually talk about this. This is actually an awareness program for the people to know. Our market women must know, if it's actually for us to actually have this program in the local dialect for them to understand, individual local dialect, to know that the risk of all this infection is so high. We need to maintain high and good environmental hygiene. Now, sometimes it's not easy. We can say that store in the rodent-free proof in our houses. Are we going to be storing all those things, a bag of rice, bag of beans also in the shops too, in the rodent-proof sacks? It's actually maybe a bit challenging for us. But I think if our environments are free, are very clean, rats don't go to a clean environment, they go to a dirty environment. If our environments are very clean, if we ourselves are maintaining good hygiene, now we can use rodenticide too outside our shops and the rest. Actually, the chemicals actually send all these rats away. So these are actually other measures that we can use that can actually assist us in curtailing the spread of this disease, at least to a minimum, so that at least we won't have an outbreak in places like Lagos. You know, that one can be very terrible because of the way we live and because of the congestion in Lagos too. So we can actually prevent that. In some countries where we have issues about this, they isolate them, they treat them before they allow them to move around freely. So those are things we need to do. When we pick patient that has this, we should isolate them, treat them first. We should make proper awareness on the radios, make jingles, and tell them the problem about it. Because the moment you have a full infective Lassa fever, 15 to 20% of them die of that disease. And I'm sure, you know, 8 people have just died already now. We don't know how many people that is infected yet. So, and also, if you notice as an individual that you're having headache, backache, and you are not sure, please stop using drugs on your own. Stop patronizing the patent medicine stores. Stop going to people, just using your own drugs yourself. Go to the hospital, go to your health officer so that at least they can actually make the diagnosis earlier, then you can be treated with ribavirin.
During the last outbreak last year, about 500 people died. The federal government, state governments, all governments at different levels, they teamed up to, reduce the prevalence. Why is it that we have the outbreak again?
Well, you have actually mentioned part of the things I'm about to say. You know, that was why I gave an example of the Ebola crisis. Now, in those areas that we now have outbreaks now, people are being laxed out now. They are not so conscious about their environment again. Environmental sanitation is not properly done. They don't actually take into cognizance that this, no. You know, I said that we can't actually eradicate the disease because it's difficult for us to kill all the Mastomys natalensis rats. And if it is difficult to do that, definitely we need to actually be on guard. I'm sure in these areas that we have now outbreaks, it's actually, I'm sure it might be one rat that is there, but because we are not maintaining the high level of hygiene, good hygiene is no more in place. So this one infects one, I'm sure it's from one to another, then it now becomes a major issue in those places. So at every point in time, we should maintain a good hygiene, a proper hygiene, good community hygiene, good personal hygiene. These are actually things that we need to maintain.
What advice do you have for members of the public and health officers?
Well, divided into the public and to the health officers. Now, to the public, the question is this: when was the last time any one of us actually carry an hand sanitizer around? In the days of Ebola, people carry hand sanitizers. People maintain every good sense of hygiene. I don't want to touch you, don't touch me. The same thing applies to this Lassa fever, because it's actually one of the viral hemorrhagic diseases. It had the same presentation, though it's not as deadly as Ebola, because Ebola has a short period of incubation. But this one also is actually to be treated like an Ebola. So same thing to the public, we must maintain a good community hygiene. We must maintain good personal hygiene. All our foods in the house, we must put them in rodent-free container, rodent-proof container, so that at least no rodent can actually have contact with our grains and our foods. Then two, we must continue to wash our hands. All schools, most schools, all organizations should have an hand wash basin. Once you enter the place, you wash your hand. Once you go out, you wash your hand. When you get home, you should wash your hand. If you have an hand sanitizer in your pocket, then you just put it. Now to the health officers, we are actually at the forefront of all this. The moment there's issue, they bring it to the hospital. Now, it is highly important for all doctors now, even nurses or health people, to also maintain the standard disease precautions every time. Everybody you see should treat as if this is the Lassa case. In that case, means that you must use your glove, your goggle, your wet coat, and every other thing. Just treat every patient you see as an infectious case. Then you have to maintain that standard. Then another thing we have to do is this, because when you notice the patient is actually having a fever of unknown origin, you've done everything, the patient is not getting better, it's better for that individual to make a report to the Ministry of Health, so that these tests can actually be done on time, in order to save the life of that patient and to curtail that disease. And when you notice that there is a person that is actually having this, it's better to quarantine that person, isolate that person over the period of time to reduce the spread of this disease.
Thank you so much, Doctor, for sharing your thoughts on Lassa fever. We really appreciate your efforts.
Thank you very much. It's my pleasure.
That was Dr. Temitope Tawoshe Adebayo on measures for prevention and control of Lassa fever. Up next is Trending. Please stay with us.
The microbiome to prevent, diagnose, and treat disease.
And the trillions of bacteria making up communities in our body are called the microbiome. Chemicals emitted interfere with the way food is digested, medicine is deployed, and how a disease, like heart disease, metabolic disorders, or even cancer progresses. Discoveries are being made on potential of the microbiome to develop new diagnostics that can detect relevant microbe imbalances, that can create new therapies to correct imbalances, and can advance new probiotic products to prevent dangerous imbalances. A newly created National Microbiome Initiative will invest $121 million from federal agencies and another $400 million from outside sources to accelerate research and development and make the microbiome healthcare's most promising and lucrative frontier in 2017.
Hope you enjoyed this week's edition of Sound Health. For your comments and inquiries, please send SMS on 08035826603 or on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.